The sensitivity on our fingertips is the maximum in any part of the body.
I mean, you're saying from compared to the whole body?
I would like to, indulge me to perform a small exercise wherein you try to tie your shoelaces with your thumbs tucked in. Can you do
Yes.
that?
No, it's extremely
Exactly.
difficult. हाथ में चोट लगी है. Can you move your fingers? Fracture knee. What do you have to say about that?
Oh my God, this is such a. I want everyone to understand that a hand surgeon is not one who performs surgery for everything. In fact,
Rather than calling a hand surgeon, maybe we can call you hands that heal.
oh, exactly, yeah.
And we just don't know. Abhi somebody comes and tells us कि ice लगा दो, I put an ice pack. Then अरे ice क्यों लगाया? इस पे तो hot compression लगाना चाहिए. Then I put a hot pack. So please help
कब
us
क्या
out.
करना चाहिए?
कब क्या करना चाहिए और क्या सही होता है? And I'm very sure many of us have this doubts with us. Knuckle cracking.
Yeah.
Knuckle cracking.
And even I have a habit. So knuckle cracking.
So I'll assume that since you did it, it's not harmful at least.
Well, so let's bust the myth, if we were to, in one sentence, if I were to say it.
Hello and welcome to our podcast. I'm Dr. Tushita Roy. I will be your host as we dive into thought-provoking questions on a few interesting topics with our favorite doctor. So today we have Dr. Abhijit Wahegaonkar. Dr. Abhijit Wahegaonkar is a distinguished orthopedic surgeon based in Pune and is known for his exceptional work in treating complex conditions with wrist, hands, and elbows. Doctor, welcome on today's podcast.
Good afternoon, Dr. Tushita, and thank you so much for having me on your podcast. This is very exciting because I think this is a great opportunity and a medium to reach out to people in an informal way and perhaps introduce them to the very less known subject of hand surgery. Thank you.
So, yes, doctor. So, as you rightly said, to begin with, help us understand who is a hand surgeon and what does a hand surgeon do, and how is a hand surgeon different from an orthopedic surgeon?
Great question, because I get this question a lot of times from people. And in fact, a lot of my colleagues also, they kind of ask, what is a hand surgeon? What do you do as a hand surgeon? So, in a very brief summary, I would say a hand surgeon is either an orthopedic or a plastic surgeon who has advanced or specialized training in the field of microvascular surgery, plastic surgery techniques, and orthopedic surgery techniques. And we put them all together to perform advanced and specialized procedures related to any problems of the hand, the wrist, and the elbow. And this is what a hand surgeon does. And it is a nice way of looking at a hand surgeon as an orthoplastic surgeon rather than as an orthopedic or a plastic surgeon, because the plastic surgeon will be utilizing orthopedic techniques and microvascular techniques, whereas an orthopedic surgeon will also combine plastic surgery techniques and microvascular techniques to perform complex procedures on the hand.
So, thank you, Doc, for that. But what we feel is, I personally feel hands are just much more than part of our body, but it is most frequently ignored. So we don't reach out to you until our daily to day activities are hampered. So coming to the hand injuries part of it, Doc, we have heard so much about hand sprains, hand strains, ligament injury, and these are so much confusing. Can you help us understand these a little bit?
Sure, and I think that's a nice question again. Albert Einstein once said that the hand as an organ is second only to the brain in its importance in the human body. And come to think of it, whatever we can conceive and imagine, we we can do that with our hands. An artist can paint, a sculptor can make sculptures, a surgeon can perform complex
So
surgeries.
multitasking kind of an
Exactly,
organ.
yeah.
Yeah.
And a small child can do different activities with his hands where he's learning dexterity. So it's a very complex mechanism. Imagine God has packed so much of stuff in this small space.
Yes.
So that makes it a very, very complex structure. And it will surprise you and interest you to know that the sensitivity on our fingertips is the maximum in any part of the body.
I mean, you're saying from compared to the whole body
Exactly.
on the fingertips.
Exactly.
Okay.
So on your fingertip, you can make out the difference between two sharp points
Mm-hmm.
at a distance of as less a distance of about 3 millimeters, whereas on the other part of the body you cannot. So the representation of the hand and the thumb is maximum in the brain, right? And we like to always say that we are on top of the food chain. The human evolution has been such that our ability to pronate and supinate because of this joint and the wrist joint, and the thumb, the ability of the thumb to come in front of the fingers, makes us so dexterous, makes us so, it's so convenient to use the hand in different positions and do different tasks, right from tasks requiring great strength to those requiring a lot of precision. And even the lightest of touch can be perceived. And that is the importance of the hand. I would like to, indulge me to perform a small exercise wherein you try to tie your shoelaces with your
Hmm.
thumbs tucked in. Can you do
Yes.
that?
No, it's extremely difficult.
Exactly.
I mean, to be honest, here and there when I cut my fingers, especially the thumb, that's when I realized that how important the thumbs are. I mean, I can't even hold a spoon. Forget
Exactly.
about tying a
Exactly.
shoelace.
Exactly. So, be it injury, be it arthritis, be it a child born with some kind of a hand problem where the fingers are stuck together, or he doesn't have have a thumb at all, he or she. Can you imagine the problem the child would face as the child grows up? Or an elderly person who's having arthritis of the thumb is not able to open the jar of a bottle, or
True.
he's not able to eat because of the pain. And a worker who has injured his hand will be at the same disadvantage as anyone else. We have IT professionals. They work the whole week and they are weekend warriors. They have some kind of a sports hobby over the weekend.
Yes.
And working at the computer for sustained periods of time can
Mm.
cause their nerves to be pinched either in the neck or the elbow or the wrist. And again, that can cause a very annoying kind of pain, which is relentless, right?
Mm.
And that can be so disturbing.
Mm-hmm.
And then if you're playing over the weekend,
Mm.
sports injuries can be another reason
Yeah, because
why.
you are not doing anything over the entire week, and all of a sudden you are super active
Correct,
on a weekend.
correct.
And India being the crazy about cricket.
True that. So there are so many injuries that can happen. Now, very quickly coming back to the question that we began with, you can
Difference
have.
between a hand sprain, hand
Correct.
strain, and ligament injury.
Very true.
Yes.
So we tend to confuse that and we tend to neglect those injuries ever so often. So whether it's a sprain, strain, or a ligament injury, these are just varying grades of the injury.
Mm-hmm.
A ligament injury is wherein you have a complete rupture of the ligament. And very quickly, just so that we understand, ligaments are those structures which give stability to a joint. As you move your fingers or your wrist or your elbow
Uh-huh.
and apply strength without having any pain and instability, that is because of the ligaments. Now, if any one of these ligaments is damaged,
Mm-hmm.
you will have some kind of a discomfort or pain, and the severity of the pain will be proportional to the type of injury you have had. Usually, strains and sprains will heal over a period of time,
Mm.
but ligament injuries usually do not, and they usually require a surgical intervention.
Mm-hmm.
A lot of times people think, well, I've just had a sprain and it should heal in about 10 days, and
Mm-hmm.
that's not the case.
Yeah.
So you have to be very cautious, give it the time to heal,
Uh-huh.
and then put yourself on rehabilitation before you can recuperate your activities.
Mm-hmm.
So it may take anywhere between 6 weeks to 3 months for these injuries to heal properly when it is a strain or a sprain. And then gradual rehabilitation and therapy will help you get back to your activities, both professional as well as your leisure activities. So I hope that answers your
Yes,
question.
yes, it does. But doc, I really want to know that, how long, so suppose if I injured my hand today, so how long do I wait before I see you?
Great question. If you have a hand specialist in your town or wherever you live, I think any injury which seems uh, to be quite bad, or you think it's not settling down in a reasonable period of time, it is always best to see a specialist at the earliest possible. If the injury is quite bad, wherein, say, for example, you're dislocated a joint,
Hmm.
you should go to the emergency department and consult a hand therapist or an orthopedic surgeon to begin with, who will then guide you and counsel you regarding the injury. I think, in my humble opinion, it is always best to see a specialist to explore the options after having diagnosed the conditions, and then follow the advice that is given to you by the expert,
Hmm.
rather than trying to find solutions online or assuming that everything is fine. It'll perhaps take you a little bit of time to get to the hospital, maybe a little bit of waiting time in the waiting
Yes.
room, but then you are reassured and you are at ease knowing that the injury that you have suffered is relatively minor, or if it is major, what needs to be done about it. So I really encourage our viewers to please consider seeing a specialist at the earliest possible and find the options for your problem and the solutions therefore.
So if you have a hand injury which has been nagging you for quite some time, it's time you go and see the doctor, because not everything heals with a resting period.
Absolutely. Or
So,
neglect for
or
that matter.
neglect, yes. So now, moving on to the next part of it, there's also a very common confusion among most of us that हाथ में चोट लगी है, can you move your fingers? तो fracture नहीं है.
Bilkul.
I mean, self-diagnosing, what we are best at. So,
Yes.
what do you have to say about that?
Oh my God, this is such a common problem we see. We feel that, oh, I can move my wrist, I can move my fingers, so everything must be
And then you do
okay.
self thing like, okay, ये हिल
Correct,
रहा है, ये हिल रहा है, okay, I'm good.
correct, correct. And I'm glad again that you have asked this question, because it's a very pertinent question wherein we can, through this medium, create some awareness about hand fractures. A lot of times, you may have what is called as a hairline crack, right?
Yes.
And you may have a relatively minor fracture that at the get go may not be as bad, and you are able to move your fingers.
Hmm.
Because understand that to be able to make a fist, your fingers have to bend, or they have to move in three joints. There's so many bones in the fingers and so many muscles and tendons that more often than not you are able to move it a little bit.
Correct.
However, if you neglect it, then over a period of time, a relatively undisplaced, by undisplaced I mean a fracture which has not moved much from its original place,
Hmm.
may move, and maybe may become a more severe problem.
Hmm.
So I think it's best, again, in this condition, like we talked about sprains,
Hmm.
to go get yourself to the hospital, consult a specialist, get an X-ray done, make sure that everything is all right. Is it going to be okay to wait? A lot of times, hand fractures do not require surgery,
Hmm.
but let the doctor tell you that.
Let's
I would
let us not self-diagnose it.
exactly, and let us not self-medicate. Let us not
Yes.
self-diagnose. Let
Mhm.
us not, assume that everything is okay, right? I would like to kind of raise a very nice kind of thought that I've always had. You want to purchase even the smallest of things, which is relatively inanimate, or something that is very mundane, and you would then kind of perform an online search.
Yes.
You will ask friends for opinions, you will look at reviews, and so on and so
Reach
forth.
out to every possible medium for the
Exactly,
opinion. Then
exactly.
why not for hands?
Exactly. This is your own hand. This is your own health. I think we should take responsibility for our own health. And whether it is an injury, whether it is a problem, whether it is a disease, whether it is anything that is bothering you, seek the opinion of an expert. So know that there is a specialist called as a hand surgeon. And when I say hand surgeon, I want everyone to understand that a hand surgeon is not one who performs surgery for everything. In fact, majority of the conditions can be treated with medication, with splints, modification of activities, physiotherapy, and stuff like that.
So maybe we can call it, rather than calling hand surgeon, maybe we can call you hands that
Oh,
heals.
exactly, yeah. Or caring hands,
Yes.
and a hand specialist, perhaps. I think it's just a nomenclature that stands over the ears
True.
and a
True.
common kind of a way of addressing the specialty.
True.
But please remember that a hand surgeon will not suggest surgery, because anyone, including me, would be a little concerned or would be anxious if someone were to say, "Oh, you're going to need surgery for this." No,
Mm-hmm.
it's not that.
So preventive approach or preservative
Exactly,
approach is what we
exactly,
call
exactly.
it.
Non-operative methods of dealing with things. So again and again, I think I cannot emphasize enough how important it is
Mm-hmm.
for us to meet a specialist for a problem related to the upper extremity and the hand in particular.
सो डॉक पोस्ट अ इंजरी लाइक हैंड इंजरी, जैसे बचपन से मैंने सुना है, हाथ पे चोट लगी है, सो माय नानी यूज्ड टू से कि बर्फ डाल दे, अ, कलाई में थोड़ी सी दर्द हुई है, सम अंकल और आंट यूज्ड टू से कि गरम सेक लगा दो. So what is this mystery behind hot and cold compression? I think many of us want to know about it, and we just don't know. Abhi somebody comes and tells us कि ice लगा दो, I put an ice pack. Then अरे ice क्यों लगाया, इसमें तो hot compression लगाना चाहिए, then I put a hot pack. So please help
कब
us
क्या
out.
करना चाहिए?
कब क्या करना चाहिए और क्या सही होता है? Is
जी,
there any clear thing which we
जी.
can get it?
Again, a great question. A lot of times we have this dilemma as to what to do. And if you're applying a cold compress, someone else will say, nahi, nahi, garam se sekai karo, and vice versa. So, at the get go, I would like to say that as long as it is not causing any problem, either of it is okay. However, as a rule of the thumb, if you have a fresh injury and if there is swelling, which may be due to the collected blood in the hand or the wrist or the fingers, it's always a good idea to apply cold compresses.
अच्छा, okay.
All right. However, if you have a chronic problem, say for example, um, someone has an arthritic problem,
अच्छा.
someone has stiffness,
Hmm.
then it is generally a good idea to apply
Cold
hot
अच्छा, hold
soaks
hold
or hot
hot
compresses. When
compression.
I say hot, it should be about 40 degrees, the temperature of your bathing water.
अच्छा.
Okay. And moist heat is often better than dry
Dry
heat. So
heat.
these infrared things and electrical heaters are not a good idea. Never a good idea,
So वो
because
iron box से गरम
no,
करके
no, no.
no.
Oh, it can cause electric shocks. I have known of patients who have slept over a heating pad
And had
and they've
burns.
woken up with a burn.
Burns.
So be very mindful. Even the liquids should not be very hot because they will cause scalding or burns again. So it
Mm-hmm.
has to be tepid water.
Mm-hmm.
जो नहाने का पानी
हाँ
होता है
जी,
या
हाँ
जो
जी.
आप something that you can, so always test the water,
Test the water.
and you can either soak a napkin and then just wring it a little bit and then use it,
Apply it.
जो हम गुनगुना पानी कहते हैं. ठीक
Correct,
है, गुनगुना
correct,
पानी जो
correct.
होता है, so that kind of a temperature is good. Usually when there is stiffness, we ask people to take a pail of water,
अच्छा,
warm water,
अच्छा.
immerse your hand and then gently move your hand open and make your fist, so
Okay,
that helps you regain the movement gradually.
okay.
कई बार ये सवाल होता है कि should we put some salt in it,
हाँ, ये भी
rock
और एक
salt
है,
and
या
potassium
नमक
permanganate,
पानी
namak
में
pani.
डिप करो.
Bilkul. So not a bad idea. Again, you
अच्छा.
can put some salt, but it's not an absolute must. But if you do have access to it, because uh, technically, if you were to say, it matches the pH of your body,
Mm-hmm.
jo alkaline, jo
So that's
pH.
the science behind it.
Correct. There is also a lot of times we ask, people ask, should we do both?
अच्छा.
Yes, even that is a good idea. That's called as a
Okay,
contrast bath.
okay.
So you do a few seconds or a minute of cold and
Mm-hmm.
then a minute of hot, alternating.
Mm-hmm.
So that's called as a contrast bath. So
Mm-hmm.
sometimes for pains related to the upper back,
Mm-hmm.
pains related to the elbow,
Mm-hmm.
we do also suggest what is called as a contrast bath. So yes, I mean, this is a very common way. हम जैसे कहते हैं नानी के नुस्खे.
नानी के नुस्खे.
हाँ जी,
Correct.
correct.
Yeah, you
So
got the word
yeah,
right.
so you can do it this way. Just don't be very aggressive in your massage.
Hmm.
Don't use too hot a kind of very hot water.
Oil massage and
हाँ जी,
concept like that.
that's a great question again. So कई बार लोग पूछते हैं कि भाई should I do some massage with some oil?
हाँ.
There are some good preparations in our country where Ayurveda has stood the test of time for 5,000 years. Conditions related to arthritis of the hand,
Hmm.
I think that's a good way to deal with these problems. You can use an Ayurvedic oil, massage. Coconut oil is also good enough.
Okay.
Very gentle massage. And then once the oil has been absorbed by the skin,
Mhm.
you can then do a hot water fermentation. One word of caution is, we even use turmeric, or we
Hmm.
use rakta chandan, हम जिसे कहते
हाँ
हैं.
हाँ हाँ.
So these are also, have been used to stop any bleeding, but I think it's don't pack it because it becomes
अच्छा.
very difficult to remove it from the depths of the wounds, may cause infections. The best way to stop bleeding, if you have a hand injury, is to keep your hand elevated, put a small sponge or a cloth, and just give some pressure locally. All right.
Just a clean cloth with some
Correct,
mild
correct,
pressure.
correct. So I think maybe we can talk about this in great detail in another episode, perhaps,
Yes.
where we can create awareness as to what should a person do in case of a hand injury.
So to sum it up, all it's if it's a fresh injury with a swelling, go for cold compressions, and if it is a chronic injury or a chronic condition like arthritis, go for a hot compression, but not dry heat.
Yes. And before we conclude on this topic, the skin has to be normal
Okay.
in that area.
Okay.
See to it that you don't have any cuts or open wounds,
Mm-hmm.
or if you don't have, and you don't have any skin conditions.
Uh-huh.
If you do so,
Mm-hmm.
always consult a specialist again, and then follow the advice that's given to you by the specialist
Mm-hmm.
into it. So just don't do stuff at home wherein you have a skin condition or an open wound. It's always best to see a specialist and then follow the advice given.
So, Doc, coming to the next point, and this is one of my very personal favorite, and I'm very sure many of us have this doubts with us: knuckle cracking.
Yeah.
Knuckle cracking, because for some, bachpan se, my mom has told ki don't do this; it will injure your
Joint,
joints.
correct.
And for some, it is like it's so annoying because you're sitting somewhere and somebody's like tuck 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 tuck, you know but again, I see some people when in gyms and all that, when they do warm up, they kind of stretch, they kind of crack a few knuckles. So, what is knuckle cracking? I mean, is it harmful, annoying, or is it a form of exercise? What is it?
Great question, and a very astute observation, I would say. Knuckle cracking is so commonplace, and the parents will scold their children if they're cracking the knuckle, or we, kind of find it annoying if someone next to us is doing it. There are some people who do it ever so often.
Yeah, in every 15 minutes. I don't know
Correct,
how they do it, but then.
correct, correct. And even I have a
Ah.
habit. So knuckle cracking.
So, I'll assume that since you did it, it's not harmful, at least.
Well, yes. So let's kind of bust the myth, if we were to, in one sentence, if I were to say it, it is not harmful. So, knuckle cracking is nothing but a gas bubble that bursts within the joint. So, as you stretch your fingers, the space in the joint increases, and there are nitrogen bubbles that are formed in the fluid of the joint, the lubricating fluid, which is called as a synovial fluid, and that bubble bursts, causing that popping sound. And it just makes you feel a little, kind of relaxed, or it'll free up your joints. And how do we know it is not harmful? Is it just an assumption? No. In fact, there have been scientific studies that have been performed to dispel this myth. Way back, long ago, there was a doctor in California who cracked his knuckles in one hand at serial intervals, and
Acha.
the other hand he did not. And he took sequential X-rays over a period of time,
Mm-hmm.
and then he documented that there is no joint change that's happening in terms
Okay.
of arthritis or whatever.
Okay.
And there has been a mathematical model that has been formed to to demonstrate that there's a gas bubble that forms, which will rupture or will burst and cause that noise. So, knuckle cracking in itself is a very common thing that we all do. Some find it annoying, some find it stress relieving. If we do it ourselves, it's often a great way to just relax and feel free in the fingers.
True.
For the person in the room, it may be
A little
annoying,
annoying.
little annoying, but no, I think it doesn't cause any untoward effect or an untoward problem. As long as your knuckle cracking is not painful,
Mhm.
as long as there is not much of swelling, or not much, I would say no swelling over
Hmm.
your
Hmm.
fingers
Hmm.
and stiffness in your fingers,
Hmm.
I think cracking your knuckles is okay.
So if you don't have pain, if you don't have swelling, if you don't have stiffness, go ahead and do.
Yep. I
Okay,
think it's time I crack my knuckles as well. Yeah.
so one more thing which we have often heard is this tingling sensation of fingers.
Yes.
Yeah, I can already see a smile on your
Yes.
face. So tingling sensation on the fingers, and when these days the information is so much available on internet. You go on internet, type tingling sensation, and it will throw out search results like carpal tunnel, cubital tunnel, thoracic outlet. I don't know what all terms it shows up, but a few of these terms like carpal tunnel, we have heard it over a period of time that it's a workplace related condition or syndrome. Also, carpal tunnel is also often associated with pregnancy, tennis elbow. So many things around it. So, what is carpal tunnel? What is cubital tunnel? And how are they? Are they the same thing?
Sure.
What do you have to
Right.
say?
Great question again. And, this is such a common problem that we encounter. But before I begin talking on this, I think the entire exercise of this podcast is not to self diagnose, right?
Yes.
So I again urge our viewers to not
No
just,
self
yes,
diagnosis.
so don't put your symptoms on the Google search engine, or on the online search engines, and just come up with a diagnosis. Perhaps you may even find treatment modalities, and then you would self
Yes.
medicate. So, no self diagnosis, no self medication.
Medications.
If you have any of these symptoms, please see a specialist.
And it's better, always better, you get the right peace of
True that,
mind.
true that. So, coming to these questions in particular, tingling numbness has so many different causes, and people may describe their symptoms in so many different manners. People will say, I have pins and needles. People may say, I have this burning sensation. People will say that I have this very odd feeling in the finger. Something doesn't feel right. It feels heavy and blunt
Hmm.
and
Hmm.
coarse.
Hmm.
In our country, in Hindi, people say झंझनिया,
हाँ
झंझनाहट हो रही है,
झंझनाहट हो
झंझनाहट
रही
हो
है.
रही है. या तो हाथ भारी
सुन
लग रहा
पड़
है,
गया
सुन
है.
पड़ गया है.
Correct.
So all of these are indicative of some nerve getting pinched in the upper limb.
अच्छा.
Now, let me share with you a very common experience where we have tingling, numbness
Hmm.
almost every day.
Hmm.
You sit cross-legged for some
Yes.
time,
Yes.
and then you start having numbness in your
पैर सो गया.
पैर सो गया, right? That is because there is a nerve behind the thigh which is called as a sciatic nerve,
Hmm.
और उस पे प्रेशर आ जाता है,
Hmm.
and then people will start having this numbness, and थोड़ी देर में चला जाता
चला
है.
जाता है.
Now, when any nerve is getting pinched for a sustained period of time and that pressure is not going away,
Hmm.
that is when the pins and
अच्छा.
needles will persist.
अच्छा.
Depending upon which nerve is involved,
Hmm.
uh, the pins and needles sensations will be felt at different parts of the body or the hand or the fingers. The carpal tunnel syndrome that you referred to is where a nerve called as a median nerve is
Hmm.
getting pinched at the wrist joint,
Okay.
and the median nerve supplies the thumb, the index finger, the middle finger, and half of your ring finger.
अच्छा.
So, whenever people say that they have pins and needles in the thumb and the index and the middle finger,
Hmm.
or a part of the ring finger,
Hmm.
that is when we start suspecting a
That it's a
carpal tunnel
carpal tunnel.
syndrome, where the nerve is getting pinched in the wrist joint. There are so many different causes of it. Majority of the times we don't know why it happens.
Okay.
However, conditions such as diabetes,
Hmm.
hypothyroidism,
Hmm.
post pregnancy or during pregnancy when the mother is having water retention,
Hmm.
that is why, or fluid retention, that is when the pressure on the nerve may increase and they may have pins and needles. The commonest symptom that people complain of is waking up in the middle of the night with the hand going heavy and they have
Yeah.
to, kind of
Shake
shake
it
their
multiple
hands.
times.
Correct,
Yes.
correct. Cubital tunnel is also a nerve getting pinched in the upper limb, but but here the nerve is getting pinched behind the elbow.
Acha.
We jokingly say that God forgot to bring the nerve in front of the elbow because the other nerves are lying in front of the elbow,
Yeah.
whereas the ulnar nerve
Lies
lies behind the
behind
elbow.
the elbow.
So when you bend or you flex the elbow at 90 or beyond and you keep it at that
Huh.
particular position, for
Position.
example, you're talking for a very prolonged period of time on a cell
Time.
phone, you're typing in odd positions,
Where this is not getting enough rest or
correct,
something
or
like that.
stretch,
Or
and
stretched.
that is when you start similar to sitting cross-legged, right?
Correct.
If you stretch, you feel better.
Yes.
So people will experience numbness in the little finger and half of the ring finger, and that is when we might have the diagnosis of cubital tunnel.
Hmm.
Again, it is the expert who will tell you what your diagnosis is. Is there any cause that we can find? A lot of times we say the way we work, our posture
Hmm.
is responsible for these nerves to be acting up or they're getting pinched, but there is no concrete evidence. ऐसा नहीं कि just because you're an IT professional you are more susceptible to having a carpal tunnel syndrome than another person who's not an IT professional.
Hmm.
So, although we say that occupational hazards or occupation may be the reason, we don't have concrete evidence to say that. If you have any underlying problems such as diabetes, hypothyroidism, or gout, or any ganglion cyst perhaps in your carpal tunnel, that may cause a nerve to get pinched.
Hmm.
It is your doctor and your expert in hand surgery who will help you with the diagnosis
Hmm.
and the treatment for these problems.
So that was about carpal tunnel and cubital tunnel. Now, one more terminology which I saw a lot was thoracic outlet.
Mhm.
What is thoracic outlet? I mean, what is that? I mean, is it as severe as these two, or what about it?
Great question again. So, carpal tunnel and cubital tunnel is just one of the two conditions wherein the nerves can get pinched in the upper limb. But truth be told, our nerves, right from their origin to where they end, can get pinched anywhere due to any reason.
Hmm.
So our nerves basically originate from the spinal cord
Yes.
and they exit from between the vertebrae and they come into the neck. They go behind the collarbone and then between the first rib and the collarbone, and they will enter your armpit, and then from the armpit they will then start going towards the destination. Imagine a fuse box where you have multiple wires together,
Wires.
and then each individual wire in a room will either give electric supply to a fan or to a bulb or a tube light,
Sure.
pretty much like that. So
Hmm.
our neck is a circuit box
Hmm.
wherein all the nerves they kind of come together and they form a very complex structure called as a brachial plexus,
Hmm.
and then they will start becoming individual nerves as they go distally into the arm and towards the forearm.
Hmm.
So right from the beginning or the origin to the end point, these nerves can get pinched. Now, the pinching of the nerves or pressure on the nerves can occur because of what we hear so often, spondylosis or a slip disc. But
Yes.
that's something that a spine surgeon will usually take care of.
Hmm.
We, as hand surgeons or upper limb surgeons, often encounter an entity which is called as thoracic outlet
Hmm.
syndrome, wherein there is some stretch and pressure on the nerves in the neck. And this is such a common problem which is often misdiagnosed, or the diagnosis is not made because, as we say, the eyes will see only what the mind knows. A lot of orthopedic surgeons, a lot of upper limb surgeons do not even know about the entity of this problem. So, this is
Oh.
a condition that often affects the working age group,
Hmm.
20s to the 60s. The female gender is about 4 times as frequently affected
So
as
you're saying
men are.
it's more prevalent in females than
That's
in
correct.
males.
That's correct. And we don't know why. One of the thoughts is that women have their household chores because besides their professional activity. So any time when you're required to work with your hands in front of the body, it could
Mm-hmm.
be typing, it could be chopping, it could be rolling,
Mm-hmm.
it could be lifting.
Mm-hmm.
So common professions that we encounter are beauticians, IT professionals, homemakers,
Acha.
or even doctors. So when you're
Mm-hmm.
working with your hands for sustained periods of time in
Mm-hmm.
front of your body, there is a stretch that is occurring at your neck level.
Mm-hmm.
And then to add to it the bane of our existence, the cell phones, right?
Mm-hmm.
We are using our cell phones
Yes.
in front of our face like this, and that over a period of time you will realize that your shoulder is hurting, your arm is hurting, and you have this very vague and annoying aches and pains that
Mm-hmm.
refuse to go away. There's often a feeling of weakness, heaviness, pins and needles. So any of these symptoms which are coming from your neck all the way to your hand
Mm.
are labeled or rather are often diagnosed as thoracic outlet.
Acha.
I would like to share with you that 97% of the times this is a clinical diagnosis, and a lot of people will have all tests turn out to be negative or non-contributory. A lot of people will come to us with a bunch of tests which really fail to clinch the diagnosis. So again, a very earnest appeal to our viewers to please consult a specialist if you have any of these symptoms. Do not self-diagnose, do not self-medicate. If you're having symptoms such as these, which we mentioned a while ago,
Mm-hmm.
and they're not going away, consult a hand surgeon, a hand specialist, and he will guide you. Majority of the times, this is treated with modification of activities, physiotherapy, and some medication.
Mm-hmm.
So don't think that this needs surgery all the time, right? So that's thoracic outlet syndrome.
So, Doc, another significant health concern that
Mhm.
has, emerged over the last decade are the work-related injuries or conditions, be it a blue-collar job or a white-collar job, especially white-collar job in a place like Pune, which is the growing IT hub of the country. People spend hours together sitting in front of the system or in a particular place with a very sedentary type of lifestyle.
Mhm.
So, what are these work-related injuries, or can I call them under repetitive stress injury, or what is it?
Sure. So again, this is a great question and needs to be addressed, and I think we need to share some information regarding this. So occupational hazards or work-related injuries are not uncommon in the field of orthopedic or hand surgery. And like you rightly said, if you were to kind of segregate them into a white collar or blue
And the
collar
blue
job,
collar jobs,
uh,
yes.
it's simply because the injury patterns are different,
Uh-huh.
right? A blue collar job, especially when there is a manufacturing industry or a machinery related
Hmm.
industry, the type of injuries are much more severe, wherein there are cuts and wounds and crush injuries or burn injuries that may happen. For example, some worker's hand going into a machine which has got moving parts, and then either there can be an amputation or the hand may get crushed, so on and so forth.
So these are all typically blue collared
Correct,
injuries which we
correct.
are talking
However, the white collar jobs that we talk about, now this could either be the IT profession or even a secretary who's working in the office with a
about.
computer all the time, or a
Mm-hmm.
student who's sitting at home and doing online classes.
Mm-hmm.
They're pretty much subjected to the same problem that an IT professional is. So, spending a lot of time in front of your computers, I'm always reminded of that meme
Mm-hmm.
wherein we began as apes all
Yeah.
crouched up,
Yes,
and
and
then
then
we
we
evolved
learned how
to
to
correct
stand, and
stand
now
as
again
homo
we are
sapiens,
going
and then again we are
we are going
kind of
back to that
crouching
crouching.
in front of a
Yes,
computer.
yes, yes.
It's a very very poignant kind of a reminder about our lifestyles.
Yeah,
Yeah,
like how we
correct.
evolved and then again going back to where we
Correct,
started.
correct. It is the reason why we have started developing these problems. I
Uh-huh.
don't recall my grandfather or my grandmother ever having these
Yeah,
problems,
they
right? Do you
never.
recall your
No,
grandparents? No.
no, no.
That is, I think, because they never sat in front of computers for prolonged periods of time, or they were not sitting in front of computers or using cell phones, right? Now you see every child, every individual, whether old or young, is glued to his
Glued
cell
to that
phone, right?
screen.
You're texting, you're playing games, you're talking on the cell phone, you're using
It
computers.
has
So
become a part and parcel of our
exactly,
daily life.
exactly. Technology has permeated our lives. As doctors, we too are using computers ever so
Mm-hmm.
often, right? We are using these EMR, electronic medical
Medical
records, where
records.
we are doing away with paperwork and using the computer. So, and the way we work, right? For when you're doing surgeries, for example, your hands are
So even you
stretched
are
out.
not spared.
Absolutely not. I had the problem not too long ago wherein my hand was feeling so heavy and painful.
Huh.
I literally had to lift my hand up to be able to move it. It was quite bad.
Hmm.
So we have a lot of these youngsters in the working age group or middle-aged people, predominantly women, but then males are also not spared. So these people have weakness and heaviness, and all of this is because of what we call as repetitive stress injury
Hmm.
or thoracic outlet
Mm-hmm.
syndrome. So people may have symptoms of tennis elbow, people
Acha.
may have symptoms of cubital tunnel syndrome or carpal tunnel, what is called as a golfer's elbow. So golfer's
Yes.
elbow is pain on the inner aspect of the elbow.
Mm-hmm.
Tennis elbow is on the outer side
Outer
of the
side.
elbow. Neck pain, backache, heaviness. So we need to. A syndrome is basically a lot of symptoms put together,
Uh-huh.
right?
Okay.
So that's how we come to the diagnosis. So we
Acha.
take into account the age of the person, the profession, the complaints that he is coming to us with,
And
and
what
of
kind of
course,
his daily day, day to day
correct,
looks like.
activities and his daily schedule looks like. We always ask them for how long do you work at it. And
Ah.
even I'm surprised that once you start working on a computer, for example, I'm writing a paper or making a PowerPoint presentation,
Yes.
I lose the sense of time. We get
Yes.
so engrossed that
Engrossed.
before we know it, we realize when our back is hurting, my neck is hurting,
Yeah.
my shoulder is hurting, and then we, oh my God, 2 hours I've been
2 hours
sitting
I've
in
been
front of the
sitting in the
computer,
same
right?
position.
So I think we need to be mindful about how we sit, and how we, work. Our posture
Hmm.
is very important. We need to be very mindful about the time that we are spending.
So you are more kind of pushing this towards the work time related stretchings
Correct.
and the kind of
Correct.
movement that we need to make. And of course, these days I think we have enough smart watches which kind of throws you a reminder. Enough of
Yes.
sitting, I think time to stretch.
Yes. I think smarter than a smartwatch is just put a screen lock.
Yes. Yeah,
Okay.
that would be
A
a great
screen
idea.
goes
Screen lock.
right, and just be mindful. And so this is what is called as a repetitive stressing. Imagine a drop of water that keeps on falling on
A
a
stone.
rock or a stone,
Yeah.
and that rock or stone will also crack
Eventually cracks.
eventually.
Yeah.
This is just the human body, so it will take its toll, right? So this is a cumulative
Mm-hmm.
or repetitive injury. So
Mm.
over a period of time, multiple such minor insults, your body is tolerating the abuse that you're subjecting it to, and then later on the body will just give up and say enough is enough.
Mm-hmm.
So I would really urge our viewers to please be mindful about their posture,
Listen to your body.
right? Listen to your body, get into some kind of a stretching and a fitness regime.
Mm-hmm.
Again, just don't do random yoga postures,
Hmm.
just don't do anything that you see online. If you have these symptoms, consult a specialist. There is a specific protocol that we ask people to follow.
Hmm.
Once you get better, of course you
Hmm.
can do your yoga and stuff, and of
Hmm.
course I think the happiest moment for a doctor is when his or her patient gets better, right?
And stops coming back to you.
Exactly, exactly. I always tell my patients, stay away from doctors and
Yeah,
hospitals, right?
don't come to us.
Correct. Don't come to us. And that is our entire endeavor. I think every doctor's endeavor is to uh, put his patient's interests first, to educate the patient. Do you know something, Dr. Tushita, that the word doctor stems from the Latin word dossier,
Uh-huh.
and dossier means to teach.
To teach.
So a doctor's primary responsibility is not to treat,
Treat, but to
but
teach.
to teach in prevention, teach
Hmm.
his patients, make them aware of their condition,
Mm-hmm.
tell people around. So prevention is better than cure comes from
Complete
that
preventive
concept.
approach towards
Correct,
healthcare.
correct, correct.
Beautifully.
Educate the people, educate the patients. So Coming back to the, I'm sorry I digress, but then coming back to this point of repetitive stress injury, it is much more prevalent than you and I can imagine.
Hmm.
My daughter has it, my wife has it, I suffered from it, and everyone around us. So whenever I
So it
go,
doesn't leave any age group,
oh
you are saying?
no, oh no, it is everywhere.
Oh,
I'm sure someone in your home must be having a problem, neck pain,
yes.
arm pain,
Yes.
and it just doesn't go away easily. But we can, kind of cure it, or we can try to alleviate the symptoms
Hmm.
with simple measures like corrective posture, with having an ergonomic way of working. When I say ergonomic, ideally, when you're working at the work desk, your shoulder should not be, shrugged or slouched.
Hmm.
You should sit straight. Your knees and hips and ankles should be at 90 degrees, and you should not work too far away, but
Hmm.
in a relatively comfortable position with complete support to your
Support on
forearms
the
and the wrist.
forearms.
Okay.
Yes.
Do you know a funny thing? There are some statistics that say that an average IT professional
Hmm.
will walk on the keyboard for about a few miles with his fingers. Right? It's funny, and then that entire stress is
Yeah.
borne by our upper limbs and nerves, and they act up. I
True.
hope I am able to, kind of clarify a little bit
Oh
about.
yes, it's very helpful, and it's very kind of great information that we
Thank you.
got today. And I'm very sure many of our viewers will relate to it and will understand. And the takeaway message from here would be that if you are facing any issues,
Hmm.
and if you have any condition that is bothering you from quite some time, don't wait for it to resolve on its own. Ask
True,
for help.
true that, true that.
Yeah. Anything else you want to add on,
No,
doctor?
I just want to express my gratitude to you. Thank you for having me on this podcast. I
So it
think,
was a beautiful session that we had
thank
today,
you.
and coming out with so many questions. And trust me, I have a lot more here, but I know I cannot take much time of yours. So maybe we'll soon
In
have
another episode, perhaps.
another
Yeah,
podcast
I
with
look
you.
forward.
And if you have any more questions, please feel free to drop it in the comment section, and we will get Dr. Vahegaonkar back on this podcast again with us. That's all for today. Thank you.
Strong and healthy arms and hands.
Yes, and the hands that heal.
Thank
Thank
you
you,
so
doctor. Thank
much.
you, doctor.
Really appreciate it. Thank you so
Thanks.
much. Good
Thanks,
day.
doctor.